Otitis media, or simply an ear infection, is a common ailment, especially among children. It occurs when the middle ear, the space behind the eardrum, becomes inflamed and infected. This often happens as a result of a cold, the flu, or allergies, which can cause the Eustachian tube, a small passageway connecting the middle ear to the back of the throat, to become blocked. Imagine a tiny balloon inside your ear. That's your middle ear. When it gets filled with fluid due to a blocked Eustachian tube, it creates a breeding ground for bacteria and viruses, leading to an infection. Picture a traffic jam in the Eustachian tube, preventing air and fluids from flowing freely, and you'll understand how easily an infection can take hold. Otitis media can affect one or both ears and can cause a range of uncomfortable symptoms. While it's most common in infants and young children, adults can get ear infections too. Understanding the causes, symptoms, and treatment options for otitis media is crucial for parents and individuals of all ages. How do you know if you or your child has an ear infection? Recognizing the symptoms early is key. Ear pain, often described as a sharp, stabbing sensation or a dull ache. Fever is another common symptom. Irritability, fussiness, and difficulty sleeping are frequently observed. Fluid drainage from the ear might be present. Seek medical advice for proper diagnosis and treatment. Otitis media is primarily caused by bacterial or viral infections, often stemming from common colds, the flu, or other respiratory illnesses. Think of it like this. When you have a cold, your nasal passages get congested, and this congestion can travel to the Eustachian tubes, leading to a buildup of fluid in the middle ear. Allergies can also trigger ear infections by causing inflammation and mucus buildup in the nasal and ear passages, much like a stuffy nose during allergy season. Structural abnormalities such as a narrow Eustachian tube or enlarged adenoids can increase the risk of recurrent ear infections, making it harder for fluids to drain effectively. Infants and young children are more susceptible to ear infections due to their developing immune systems and shorter, more horizontal Eustachian tubes, which don't drain as efficiently as those of adults. Exposure to secondhand smoke is another risk factor, as it irritates the respiratory system and increases the likelihood of infections. Diagnosing otitis media. Diagnosis involves a healthcare professional examining the ear with an otoscope. The otoscope helps visualize the eardrum for redness, bulging, or fluid. A pneumatic otoscope may be used to check eardrum mobility. Lack of movement suggests fluid buildup. Medical history and symptoms are also considered. Further tests like tympanometry or acoustic reflectometry might be recommended. These tests provide additional information about middle ear function. Accurate diagnosis ensures proper treatment and the best outcome. Section 5. Relief and recovery. Treatment options. Treating otitis media depends on the severity of the infection and the patient's individual needs. In some cases, watchful waiting might be recommended, allowing the body's natural defenses to fight off the infection, especially for mild cases or in older children and adults. Over-the-counter pain relievers, such as acetaminophen or ibuprofen, can help alleviate pain and reduce fever, providing much-needed comfort. Antibiotics, either in oral or eardrop form, might be prescribed for bacterial infections, effectively targeting and eliminating the bacteria causing the infection. Decongestants, either oral or nasal sprays, can help shrink swollen nasal passages and improve Eustachian tube function, allowing fluids to drain more easily. Home remedies like warm compresses applied to the affected ear can also provide soothing relief. For recurrent ear infections or persistent fluid buildup, a surgical procedure called a myringotomy might be considered. This involves making a tiny incision in the eardrum to drain fluid and insert a small tube called a tympanostomy tube, which helps ventilate the middle ear and prevent future infections. Section 6. The importance of early intervention. Recognizing and treating otitis media early is crucial for preventing potential complications and ensuring optimal hearing health. Untreated ear infections can lead to hearing loss, speech delays, and even spread of infection to nearby structures, such as the mastoid bone behind the ear. Early intervention with appropriate treatment, whether it's watchful waiting, medication, or surgical intervention, can significantly reduce the risk of these complications. Regular checkups with a healthcare professional, especially for children prone to ear infections, are essential for monitoring ear health. and addressing any concerns promptly. By understanding the causes, symptoms, and treatment options for otitis media, parents and individuals can take proactive steps to protect their hearing and overall well-being. Remember, early detection and prompt treatment are key to a swift recovery and a healthy, happy ear.